Hello and welcome. This video from the 5-Minute Exam English channel is designed for people who are getting ready to take the Occupational English Test. Specifically, I want to help people to write about a patient's future care. I reckon this is a very important OET topic, so I hope you enjoy this video. My objective for this video is to introduce some useful words and phrases that will help you to write about a patient's future care. I'm not going to teach posh words or complicated phrases, just simple things that you'll be able to remember. I believe nursing is the most popular OET variant, so I'm going to concentrate on nursing. However, the words and phrases that I plan to introduce will be useful for people who are going to take OET for other professions such as medicine and dentistry. Let me introduce you to the case notes that I have here. I invented these case notes myself, but I think they're representative of what you can find in plenty of OET writing tasks. The patient, John Brooks, was admitted to hospital with deep vein thrombosis. As you can see, there aren't any details about Mr. Brooks' social background or hospital treatment. We're going to concentrate solely on this discharge plan. I can't say that every OET writing task for nurses includes a discharge plan, but there's a good chance you'll find one when you take the exam. Anyway, let's look at my text about Mr. Brooks. The first paragraph is all about measures to help Mr. Brooks that don't involve medication. The second paragraph, as you can see, is about his medication requirements. Here we've got two instructions that the reader must follow. If you're giving an instruction to a reader, here's a good way to begin. These are polite words and they show a good level of English. Make sure that you write could, not can. Also, make sure that the verb after could is an infinitive verb, not a verb with ing. The next sentence is much simpler. It's similar to the note that we have here. I have, however, added one important word, please. This basic word will help to make any letter sound polite. Why is it important to be polite? Well, as you can see in the marking criteria for writing, if you want to get a score of 5 or more in the style and genre category, you'll need to use polite language. These two notes are not direct instructions to the reader. They are measures that Mr. Brooks himself must take in order to help his recovery. When there is advice for the patient to follow, should is a useful verb to use. And here's a nice phrase to use when the patient has advice to follow. This time it's necessary to use an ing verb after from. The information about warfarin is important. It's not an instruction for the reader to monitor Mr. Brooks' medication compliance, but it's something that the reader must know. Please note that is a useful phrase to use when you want to highlight some important information. Now, why did I use a different colour for him, he, and his? It's because I want to make it clear that case notes typically don't include these words. Likewise, if your patient is female, you probably won't see the words she or her. You have to put these words in the letter yourself. Now let's move on to the next set of case notes. This time our patient, Yvonne Hurst, is being referred to a community nurse who's going to visit her at home. Here are two instructions for your reader to help Mrs. Hurst. And here is a nice phrase that you can use when you want to request help for a patient. This small phrase can be used to request a number of different things. Up here, for example, you could write, I ask you to monitor Mr. Brooks' alcohol consumption. Here, you could write, I ask you to encourage him to follow a low-fat diet. Sometimes you have to write about a patient's future appointments. This note doesn't give us any dates for the patient's physiotherapy appointments, but it does give us the frequency of the appointments. So when you see a note like this one, try the following structure. Name of patient, plus will have, plus frequency of appointments. Finally, add the place of the appointment or the person whom the patient is going to meet, in this case a physiotherapist. In this note we can see that there's only one appointment that's been arranged. We also have a time for the appointment. My final sentence is about this appointment at the Spinal Injuries Unit. Let's have a look at my sentence now. First we have a simple phrase, then we have the location of the appointment, then we have the time of the appointment. Simple. Well, we've now come to the end of this video from the 5-Minute Exam English channel. I hope this video was useful and I hope you enjoyed it.